Welcome. I'm Joy Pace, the Director of AgeSmart Community Resources, and I'm here with our episode of Age Well with Joy. And today we have Sandy Leith, and she's the Director of the Senior Health Insurance Program at the Illinois Department on Aging. She knows everything there is to know about Medicare, right?
Right.
Today, we wanted to talk about what you should know before open enrollment begins for Medicare. That's October 15th and it runs through December 7th. It's not a time that you should ignore. It's very important. This is about your benefits. So, Sandy, let's start with what are the most important things people should be looking at during open enrollment?
This year is going to be important to look at what you have. What coverage do you have right now in 2024 and what's happening next year? It is so important to check that every year and then make that decision during open enrollment. And I must say, I've been around since way before Part D started, been doing Medicare for over 30 years, but since Medicare Part D started, this is probably the best year, the most important year to watch your premiums and your out-of-pocket expenses and really compare before you just go to bed December 31st, wake up January 1, and you haven't done anything to check that. So it's just super important to see what's out there for next year.
You know, and I think something that's important for AgeSmart, if you need assistance, to call early and make those appointments because we have senior health insurance counselors that are trained by Sandy and her team, and they book up really, really fast. So I would encourage you, if you need a little bit extra help with explaining that, call us early to make an appointment rather than December 7th.
Yeah, that's a good, sit down with somebody, do it over the phone. But yeah, SHIP, Senior Health Insurance Program, we're not selling it. We're not selling insurance. We are your advocates. We're actually Medicare funded, and it's a good thing to make an educated choice every year. So bounce it off of us, even if it's just for peace of mind. Let SHIP help you.
Great. Can you talk a little bit about Medicare costs, like the premiums and the deductibles for 2025?
Sure. It's September right now, early September, and we don't have any information on anything, but I do have a deductible for Part D of Medicare. But as far as Part A and B, your medical coverage and your hospitalization, the deductibles and premiums will not be released till later in the fall. And so when that happens, you can always grab that information on the Medicare.gov website. They'll have press releases, and you will probably hear about it if you're following Joy's website or social media with her program, as well as Illinois Department on Aging will have some of our programs and post those deductibles and copays. However, Part D for next year, as in the drug benefit, this year it has a $545 deductible before a Part D plan can start paying. Now, some plans don't have deductibles, but they can go no higher than that. For 2025, the deductible will be $590 maximum. So that's something to watch for. That will impact your pocket. It's more important to watch your mail, watch your letters, watch everything that you get in the mail. And if you don't want to deal with it right away, put it in a pile until you're ready to deal with it.
And people bring their piles to us and say, tell me what I need to look at that's really legitimate. So that's a good thing too. So with those costs though, there are some ways and things that can help people pay for that. Can you talk just a bit about that?
Yeah, so often people will say, I go to the drugstore, I get my drugs, and I just can't afford these copays anymore. Well, what a counselor, SHIP counselor would do is say, well, let's look at your income here. I don't need to know everything about what you have, but give me a range. For instance, there's extra help for Part D. That is a Social Security run program that actually pays and subsidizes your copayments and your premiums for Part D. So if you're in the area of income for that, a SHIP counselor can help you fill out an application, or you can fill out an application for extra help for Part D, and that's at socialsecurity.gov. And it's an easy application, takes 3 or 4 minutes. To give you an idea of the guidelines for that, $1,883 for an individual, that would be your monthly income or less, would qualify you automatically. And then $2,555 for a couple would qualify you with the income. And then they'll look at the assets and they will ask questions on the Social Security application. And the assets can be as high as $15,720 for an individual, or for a couple, $31,360. And the application will say what that all entails, what is counted as an asset. If you get this, it's the best thing, because it can make your premiums absolutely zero for your Part D plan, and your co-payments for drugs, the most expensive copay that you will pay is $11.20. And the cheapest for generics is whatever the generic price is, or up to $4.50. So that's pretty good. And so that would be extra help for Part D. But there's also extra help, so to speak, on what we call Medicare savings programs. And that will help with your A and B expenses, your medical. So Part D extra help is for your drug benefit, subsidies that way. You can get all the help you can handle, which is wonderful if you qualify. Same thing with Medicare savings programs. How about getting that deductible if you are inpatient to Medicare, and you're put in an inpatient or a skilled nursing facility, hospitalized, and then go to a skilled nursing. Those payments can be paid for your out-of-pocket expenses on doctor's office and all of your tests and labs and things. So yes, it can be a savings, immense savings, a life savings, so to speak. Medicare savings programs, and that's what you would call any kind of subsidies you can get. Hey, SHIP counselor, help me. I'm having trouble making ends meet. What can I qualify for?
And, I think it's really interesting. I'm so proud of the folks that work here at AgeSmart. Last year, they saved people $2.1 million in benefits that they didn't know. I mean, it includes just more than just the Medicare savings program and extra help, but those are significant. And think about what you can do with those extra dollars. It's just amazing. So one thing we've seen it every year, and we always try to say, check your drug coverage, especially because a lot of times people go, I like my pharmacy and I'm happy with my plan. And then they go to the pharmacy in January 1st and something's not covered. That's very expensive. So can you talk a little bit about that?
Yeah, I always tell people, don't feel obligated to your plan year after year after year. They're not looking for your alliance. They are a 12-month contract. A drug plan is just a 12-month contract. Or if you're in a Medicare HMO or PPO program, those are called Medicare Advantage plans, that's a 12-month contract. Every year that thing can change. What can it do? It can take providers and change their contracts with who they're doing business with. So you'll need to know that. Can I still go to my doctors and hospitals? Has that changed up on me? What are my premiums for next year? Have they changed up on me? We've had people who wake up on January 1 and they find out that their premium went from $20 to $70 a month. And they go, ooh, maybe I should have looked at this during open enrollment. That's the kind of thing that we really need to watch for. And there are changes to the Medicare law through the Inflation Reduction Act that I think are really going to cause us a kind of a ripple in premiums. This year of all years, watch your premiums, because you're going to be going, oh, Sandy said it, that I should have watched it this last year, and now it's gone up on me, and I could have saved a lot of money.
And can you talk a little bit more about that Inflation Reduction Act?
Yeah. So the Inflation Reduction Act is changing Medicare Part D big time. And I always use my father-in-law as an example. He doesn't get any extra help. He doesn't get any Medicare savings program subsidies. He lives in North Dakota. He's on insulin and Ozempic and Eliquis. Oh my, those are the big drugs, right? So I just happened to run his drug plan last open enrollment and found out that his out-of-pocket cost that popped up in his current plan was $18,000. Now, that doesn't mean nothing was covered. It just meant that his pharmacy had gone out of the network. Oh my. So I'm thinking, wow, I need to do something. Called the plan, and they said, we're not in the network anywhere in his county. So I had to move his plan. Now, last year, he had up to $8,000 in out-of-pocket expenses. And then he hit catastrophic coverage, which he will be hitting that probably very shortly, right now, actually, because he takes expensive drugs. For 2025, I need to watch that very closely. However, the Inflation Reduction Act took his $8,000 out of pocket and is taking it down to $2,000. That's only $2,000 versus $8,000 between this year and next year. That is an Inflation Reduction Act law change. No one should see more than $2,000 out of pocket. Then they will be in catastrophic coverage. And when you're in catastrophic Medicare Part D coverage, you pay zero. When do you pay zero? As soon as you meet that $2,000 out of pocket and for the rest of the calendar year. So therein lies that 12-month contract. This is the year when we're saving so much money on our pharmacy purchases. Watch our premiums, because they're probably going to suffer a bit. And that's why I think it is more important this year than ever than to check on your premiums and watch your notices in the mail, because they will tell you about that. Your current insurance will send you some out-of-pocket or notices about your out-of-pocket expenses for next year.
So it's good, but because of those premiums, you really need to be a very informed consumer.
Big time this year more than ever. I don't think we're going to have those premiums until the 9th hour. And then we have to hurry up and make some kind of decision and see what's out there for us.
Right.
And the best plan for you is the plan that matches your drug list at 100%. And you can find a pharmacy that you can get to. Unlike my father-in-law, there was no one in the county under his plan. So we had to move. So don't feel obligated. And the Inflation Reduction Act is coming to save us some money and out-of-pocket expenses. So big changes next year.
So yeah, and it is a good thing. It's especially because we see so many people who are living on just purely Social Security, and it will make a significant difference in their wallet. So
Right.
The one thing we're always concerned about here at AgeSmart and everywhere, and I'm sure all SHIP counselors are, there's scammers out there. And people are really tricky. And can you talk about what to watch for in these scams?
Sure. And I'm sure you see plenty of them in your area agency, and you guys work with the Senior Medicare Patrol as well, which is helping cut down on Medicare fraud. It's just rampant. It's rampant. And whether it be a phone call or an email or a TV commercial, when you pick up that phone and call, you are opening yourself up for a lot of stuff. So we do have scammers that cold call, and if they're trying to sell a Medicare Advantage plan like an HMO or a PPO, or if they're trying to talk to you about a drug plan, cold calls are not allowed. Emails and texts out of the blue from those companies are illegal. So cut down on that by really watching your emails and really looking at where it's coming from. If it looks suspicious, it probably is. Even if the phone call comes up, your pharmacy's calling you on caller ID, and it looks like your pharmacy, it may not be. I have a coworker that's worked alongside me for over 20 years with Medicare, and her husband picked up the phone the other day, and it was his pharmacy. He thought it was on caller ID. They wanted his Medicare number and to verify all of his information, and he did it. And then when he got off the phone, she said, "What did you just do?" She happened to be working at home that day, and they had to change his Medicare number and get a new card because he had just given that away to a fraudster because she called the pharmacy and they said, "We would never do that." So they look very legit, and they're coming in all kinds of ways. And one thing about the commercials that start on TV, they will start October 1st for open enrollment. When you call those numbers, you could be giving access to your phone number and no longer having that door up between you and a fraudster or even an insurance salesperson that you may not even want to talk to, but you've agreed by calling that number and giving them your information, then they could sell that. They could sell your information to many, many, many insurance producers or companies. That's called leads data, and the leads data, equals sales. And that's what you're doing when you're calling some of these 800 lines. Or if you have a senior that you don't quite trust making phone calls, maybe they're suffering from a little dementia, really be careful and watch what they're doing or who they're calling, because we do have people get into those kind of scams so easily.
Well, and the commercials are so enticing. I would recommend people write it down, call a ship counselor. Don't call that insurance company, because we have a lot of military retirees here, and they have the Cadillac of plans, right? And we've had people wanted to switch to what they saw on TV, which they could never get back in their other plan. So it's like you need to just be very, very cautious when you're making changes and not, ask us first before you do, because that's what we're here for.
Peace of mind. I had a lady call me this week. I had met her at a speaking engagement a year ago. She said, I'm coming up on Medicare, gave her my work information, emailed me, said, let's talk. I talked to her. She had a quote from an insurance broker, and the guy was really nice and looked up a Medicare Advantage PPO for her and gave her a premium of $104. When I pulled it up on Medicare.gov, that same plan was $0. What he was doing was adding life insurance. She was first coming on to Medicare. She knew no different. She thought every Medicare plan was $104 for all she knew. The guy was really nice, but every time questions were asked that were like a little too in-depth, he would say, you're asking more questions than anyone ever does. I'm not saying every producer out there or sales agent is a bad seed, but this one really, she reached out for peace of mind, and she ended up calling and giving him a piece of her mind when she found out that's not even a premium for her Medicare. That was life insurance she was getting ready to sign up for. And he wanted it done by the end of this week because, open enrollment is coming. It's going to be real busy. So yes, we give peace of mind every day. Hit us up. Let us know what we can do.
And guess what? All of these senior health insurance counselors are free. We accept contributions, of course, always, but as a nonprofit like that, like AgeSmart, but yeah, you could be charged a lot for Medicare advice sometimes, and hope that they're not tied with another insurance company, right? So you're getting free, unbiased, and confidential information. So
yeah, those ship counselors are vetted by me. No one gets passed into the trainings and certifications unless I have signed off on them. I have never given that up. And I can smell a fraudster from a long way away. So none of them have financial planning backgrounds where they can take the customer and try to sell them something else as far as financial planning. And none of them have insurance licenses to sell any insurance products. I'm very careful about that.
What happens if fraud does happen and you suspect it?
So, and especially in my case that I've had this week, we can indeed file a complaint to Medicare. We can file a complaint to the Department of Insurance about that person's license, and the producer regulatory group will investigate that. And 1-800-Medicare will take the complaint. They can always take an official complaint. You just spell out 1-800-Medicare on your phone. That is open 24 hours a day. 7 days a week. So yes, report. Or your ship counselor can help you. I get emails all the time. Sandy, this mailing looks suspicious. Sandy, this case is very crazy. Can you tell me what you think we should do next? And we'll work with the Senior Medicare Patrol and anyone we need to make sure that that's investigated properly. And people like AgeSmart.
Right. Every area agency on aging in Illinois has a senior Medicare Patrol person, and we're trained to help you protect, detect, and report fraud too. So our numbers out there too. So if you want somebody local. So once again, these ship counselors, who can you call when you have questions about your coverage?
So to get our ship counselors, is that what you're asking?
Mm-hmm.
Yeah. call 1-800-Medicare and they'll refer you to us at the Department of Insurance, or you can look at our website under Illinois Department on Aging /SHIP, SHIP, and that will have a list of all of our counselors. There's over 1,000 of them, and they work at 300 plus sites throughout the state, whether it be a hospital, a senior center, an area agency, all kinds of sites, that park districts, township offices. So we're up and down the state, and we're trusted entities that are there to help you. And like Joy said, get your appointment early for open enrollment. Now, Medicare is still open 24 hours a day, and they can do an enrollment in the middle of the night for you and take your drug list. Another thing you could do is go online, if you're savvy online, Medicare.gov, and start your own Medicare account, which will take your personal information, but it will track your claims as you use your Medicare and your drug list, and it will pop up every year, and you can say, okay, compare this year to what's happening next year, and it will automatically do that. CHIP counselors can also help you set up those accounts if you wish. So there's lots of ways to seek our assistance, but definitely let us know how we can help. There's also shiphelp.org. That's shiphelp.org. It's a national portal, no matter what state you live in, and you can find your SHIP within every state and all of our territories. So there's a SHIP everywhere.
Great. And sometimes they're not called SHIP. Since we're right next to Missouri, I just want to say Missouri was claimed, I think they're going back to SHIP. So it may have a different name, and Florida has something that's different too.
Called SHINE, yes.
SHINE.
And Michigan is MAP, Medicare Assistance Program. My favorite is OSHIP in Ohio. So but yes, we are.
That's funny. Really, I did not know that. So yeah, pay attention, do it early, and look at everything, and don't hesitate to call us. We're here for you. Sandy's trained us well. I say us, the collective we, because I'm not a SHIP counselor, but we have some fabulous folks that work here and at our provider organizations too. So thank you so much, Sandy, for sharing today. And all those numbers will be at the end of this video and those websites. So if you want to just check those out, please do. Any last words?
Let us help you, and just be careful, and let's let Medicare work for you. This is your benefit. It's wonderful. I love Medicare. I live and breathe Medicare. Let us help you.
Great.
It's free.
Thanks so much, Sandy. Have a great day, everyone. Thanks for joining.